Okay. So this is the skull. This bone here in front is the frontal bone. That is the frontal bone. The frontal bone has the coronal suture. The coronal suture goes in the coronal plane. Okay, the coronal suture. Behind the coronal suture, we have two parietal bones. Two parietal bones. Each of those parietal bones is separated by the sagittal suture. The sagittal suture. Okay, that's the sagittal suture here. Parietal bone, coronal suture, frontal bone. Okay. If I go to the side here, I have got the temporal bone, and on top of the temporal bone, I've got the squamosal suture. The squamosal suture. Okay. Now, just right here in this area, I have the sphenoid bone, a small portion of the sphenoid bone. Moving to the back, okay, just to recall, these are both parietal bones separated by the sagittal suture. Okay. And here in the back is the occipital bone. This is the occipital bone. And the occipital bone has the lambdoidal suture. The lambdoidal suture. So called because it looks like a lambda. Now, most of the occipital bone can be seen in this view. All right, so for the temporal bone, remember this whole thing is the temporal bone. I've got that squamosal suture. The hole here, that is the external auditory canal or external auditory meatus. Just in front of this hole, I've got a groove. And for some of you, it might have a little thingy on it that looks like gum or glue. So, but that divot here, that is the mandibular fossa of the temporal bone. Mandibular fossa of the temporal bone. This whole thing is the temporal bone. And this portion here is still part of the temporal bone. There's a small suture right here that separates the temporal bone from the zygomatic bone, which is here. Okay. This portion of the temporal bone is the zygomatic process of the temporal bone. The zygomatic process of the temporal bone. All right, so taking off the skull cap, in order to find the internal auditory meatus or internal auditory canal, you want to look for this here, and we've got a hole here and a hole here. These are the internal auditory canals or meatus. The only part of the sphenoid bone you can see from outside of the skull is just right here. Okay, this is the sphenoid bone here. To be able to see the sphenoid bone in all of its glory, you've got to peel this dude's head off. So this whole structure here, this winged structure, that whole thing is the sphenoid bone. The two structures you need to know are the Sella turcica, the Sella turcica, Sella turcica. These structures here, here and here, are the optic foramina. Optic foramina. One would be optic foramen. Okay, the optic foramina. Now, if I put this through, I could also ask you, on a practical exam, I could ask you the optic foramina in this view too. Okay, so that is the optic foramina. The ethmoid bone has structures that could be seen in a couple different ways. The ethmoid bone, you have some of it you can view while looking up the nose. And if you could imagine, if I could just go straight up the nose up here, you can see that it's not very far away. Okay, so that's still the same ethmoid bone. So the ethmoid bone has a couple of structures here that you need to know. Now, if you feel with your finger, you'll see that there's something sticking up right here. That thing that is sticking up is the Crista galli, right there. Right there. The Crista galli, the Crista galli. Okay, it means rooster comb, so you can kind of feel that right there. Now, on either side of the Crista galli, I've got the Cribriform plate. The Cribriform plate. So I think if a crib needs to be reformed, it must be smelly, okay? And these little holes in the Cribriform plate is where your olfactory nerves go through. That's your sense of smell. Okay, so that's the Cribriform plate, and that middle point, remember, is rooster's comb, Crista galli. Crista galli. All right. Now, some more structures of the ethmoid bone that you need to know. This line here is the nasal septum, and there's actually two structures here. Well, actually, this is a facial bone down here, but the top 2/3 is a structure of the ethmoid bone. So from here to here, the top 2/3 of that nasal septum is the perpendicular plate of the ethmoid bone. The perpendicular plate of the ethmoid bone. And while I'm here, we can see the nasal concha, okay? And the middle and superior nasal concha are part of the ethmoid bone. So the nasal concha of the ethmoid bone. So let's look at some structures of the occipital bone. All right, so remember, this whole thing is the occipital bone. All right, you might recall, I knew that was going to happen. We don't need that right now. Okay, remember, we've got the lambdoidal suture here in the back. This is all occipital bone, and all this at the bottom is still occipital bone. So, two structures you need to know for the occipital bone. You need to know the magnum foramen, or foramen magnum, okay, the big old hole, and the occipital condyles. The occipital condyles. The occipital condyles are going to articulate with C1, the C1 vertebrae. All right, so let's look at some of the facial bones now. So the main bone of the face is the maxilla, and that all of this is going to be maxilla, and even by the nose here is going to be maxilla. Okay, maxilla. In addition, I can turn this guy around. The top, or the anterior, about 2/3 of the palate here is also the maxilla. The maxilla. Okay, just this front part here, the maxilla. All right, so the cheekbone starts about here. This is the zygoma or the zygomatic bone. The zygoma or the zygomatic bone. There's a little suture about there, okay, that separates two structures from one another. It's about here. So this is the zygomatic bone or zygoma, and just this portion here is the temporal process of the zygomatic bone. And it's called that because it's going toward, it's actually linking up with the temporal bone. And you'll recall this is the temporal bone, and this structure is the zygomatic process of the temporal bone. So this is a zygoma, the temporal process of the zygomatic bone. This is the temporal bone, and this is the zygomatic process of the temporal bone. So a couple other things that you need to know. There's only one bone of the eye orbit that you're responsible for, and that is the bone that sits medially right here, and that is the lacrimal bone. The lacrimal bone. And I have two bones here. Okay, those are the nasal bones. The nasal bones. Now let's look at a bone called the vomer. The vomer can be seen in two different areas. The vomer makes up the bottom 1/3 of the nasal septum, so just right here. And the vomer continues to go inward and downward inferiorly. And this right here is the vomer as well. All right, so I can ask the vomer here or here. All right. And one that I haven't mentioned yet is the palatine bone. So the palatine bone lies, let's see, about here. Okay, so this posterior, like 1/3 of the palate, is the palatine bone. The palatine bone. Here is the mandible. So one structure you need to know on the mandible is the mandibular condyle. Okay, so this is the mandibular condyle. This is the mandibular condyle. And the mandibular condyles articulates with the mandibular fossa of the temporal bone. Okay, articulates with the mandibular fossa of the temporal bone. And this is the mandibular condyle of the mandible. Alrighty. Next we're going to continue with the axial skeleton, and we're going to go over what we call the thoracic cage. The thoracic cage includes the ribs, the costal cartilages, and the sternum. The sternum. Okay. So for the ribs, the only thing that you need to know is what type of rib. The question that I'll ask, because I'm not just going to put a sticker on and just say, tell me what this is. I'm going to assume you know what a rib is. But what I do want you to know is I'm going to ask, what type of rib is this? So there's 3 types of ribs. So the first rib is kind of hiding, so don't forget about this first rib here. Okay, it's kind of hiding back here. We have 12 ribs. Okay, some people have one more or one less. It's not completely uncommon. So, but in our models, we've got 12 sets, okay, 12 on each side, and they're numbered like the vertebrae. They start with number 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12. Okay. So the first 7 ribs, this would be a rib, 2, 3, 4, 5, 6, 7. Okay. The first 7 ribs, if you look closely, those ribs connect directly to the sternum via their costal cartilages. Okay. So because these top 7 attach directly to the sternum, we call them true ribs. True ribs. These bottom 3 ribs, so this one, and this one. So ribs number 8, 9, and 10. Okay, 8, 9, and 10. If you look closely, you'll notice they indirectly, okay, their costal cartilages have to merge with the cartilage above it in order to reach the sternum. We consider this configuration to be an indirect connection. Okay, an indirect connection to the sternum. So for that reason, ribs number 8, 9, and 10 are considered false ribs. False ribs. And the last type of rib we have are floating ribs. So ribs number 11, so here's the end here, 11 and 12. Here's the end. You'll notice number 11 and 12 do not articulate at all with the sternum. Hence, they're floating ribs. Okay. Do not articulate at all with the sternum, so we consider those floating ribs. This is the sternum, and these are costal cartilages. Costal cartilages. Or you could just put costal cartilage, is fine too. Costal means of the ribs. So this is the sternum. The sternum has a few things that you need to know. All right. I kind of think of the sternum, I think of like the Leave It to Beaver, you know, the 1950s stereotypical man coming home from work in his suit and tie and really stuffy, and I think of him as being stern, a stern father, right? Because if you look at it, it looks like a tie, so it kind of helps. So the sternum. Now the top knot, if you will, of the tie is called the manubrium. The manubrium. This portion is called the body of the sternum. And just the tip here is the xiphoid process of the sternum. And this is the jugular notch, just up at the top here. Jugular notch. All right, on a practical exam, the first thing that you're going to want to ask yourself when you see a vertebrae, first thing you're going to want to ask yourself is, does it have transverse foramina? These are the transverse foramina. Remember, foramina means holes, and they're out transverse. Okay, so they're on the transverse plane. If you have transverse foramina, you know you're at the cervical level. Okay, but that's not quite enough. I need to find out, is it just a regular generic cervical vertebrae, or is it the atlas or the axis? Okay, so, all right, so I first want to look for the transverse foramina. So I have transverse foramina here and here. So I know it's a cervical vertebrae, but now I need to decide, is it a C1 vertebrae, which looks like that, or a C2 vertebrae, which looks like that. All right, so let's talk about the differences. First of all, notice that each one of these, even though it doesn't look like it, if I flip this over, I do have transverse foramina. Okay, so all of these would have transverse foramina. This is a body. This is a body. The body is where the vertebral discs lie. So you get body, disc, all the way up on the skeleton. Okay, so, but C1 is the only vertebrae that does not have a body. If it has no body, it's got to be the atlas. The reason it's called the atlas, it's named after the Greek god Atlas, who held the weight of the world on his shoulders. So it makes sense. Okay, Atlas was the Greek god who held the weight of the world on his shoulders. And that's kind of what the atlas really does. My C2, instead of having no body, it has kind of a double body. And it has this phallic looking thing. Okay, this is called the dens. This is the dens. So what this is the axis. This is C2. And what this does is the dens of the axis, or C2, basically acts as the body for the atlas C1 vertebrae as well. Okay, so C1 does not have a body, C2 has body enough for two. All right, make sense? Okay, so if you see the transverse foramina, then you know, oh, okay, transverse foramina, I have to be in the cervical region. All right, so a couple structures that you need to know, and I'll go over each of them here. So this is the only one that has the dens. This is the dens. This is the spinous process. Okay, this is also the spinous process, and this C1 has a really small spinous process. The spinous processes, if you run your finger down somebody's spine, those little bumps that you feel, bump, 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 okay? Each of those, that's a spinous process. That's actually the pointy parts of the spine that come out, all right? And those act as attachment points for a lot of the back muscles. All of these, so here and here, this and this, It looks like they go together with something, right? So we actually have a pair up top and a pair on the bottom. I'm not going to be picky on inferior or superior. You could just generically call them articulating processes. Okay, so articulating processes. If you want to sound smart, say processes instead of processes. I don't know why, but that's just what scientists say. It's when you sound smart. Okay. All right, so those are articulating processes here. All right, for a regular cervical vertebrae, this is the body. These are the transverse foramina. Transverse foramina. This is the vertebral foramen. The vertebral foramen. This is where the spinal cord goes. All right. This is that spinous process. These are articulating processes here. Okay. And then right by the transverse foramen, I've got the transverse process. Transverse process, transverse process. Okay? If you're curious, the lamina is the flat part here and the flat part here. But like I said, it doesn't really do anything, so I just leave it out. Let's leave that guy over here. And let's look at a thoracic level vertebrae. All right, so you're in a practical exam. You go up to that station and you see a vertebrae. First thing you ask yourself is, does it have transverse foramina? I look at this thing and I say, nope, no transverse foramina, so it's not a cervical. So now I just have to decide, well, is it a thoracic vertebrae or a lumbar vertebrae? And let me show you how to do that. If I hold these just right, can you kind of see that there's 5 horns? 1, 2, 3, 4, and 5. Okay, there's kind of 5 horns there. And the spinous process looks like a moose horn. Spinous process is rounded and goes straight posterior. Versus this one just has 3 horns. 1, 2, and 3. Okay, so it has 3 horns, and when I look at this spinous process, so this one looks like a rounded moose horn, whereas this one is sharp and pointy. So the spinous process here is sharp and pointy and points inferiorly. Okay, whereas this one is a lot more rounded. All right, so rounded is lumbar, pointy is thoracic. All right. Another thing that you can look at is, see these things that poke up? All right, these are the articulating processes. The articulating processes at the thoracic level go almost outward. Okay, they go straight back, whereas the articulating processes in the lumbar is here and here. They face one another. All right, so the articulating processes face one another in the lumbar region. So that's another clue that can help too. And then also look for that kind of that 5-point thing. So let's make sure you know what the structures look like at these levels too. So let's do the thoracic first. All right, so this is the vertebral foramen. The vertebral foramen. This is the body. Articulating process, transverse process, and spinous process. Okay. And if you're interested, I also have 2 articulating processes in the bottom here as well. One there and one there. Okay. And last but not least, light at the end of the tunnel. All right, here is my lumbar vertebrae. That was my lumbar vertebrae. Okay. In this one, so I've got the vertebral foramen. I've got a nice big body on this guy. Okay. The articulating processes in this one kind of face each other. So here's one and here's one. So those are articulating processes. The transverse processes are here, going out in the transverse plane. If you're wondering what it looks like down here, that's your spinous process. And these are the inferior articulating processes here. Okay? And that is the axial skeleton, everything you need to know. Questions, comments, panic attacks? Or all of the above?